Welcome to OAC Health Talks. I'm Joe Naglowski, OAC President and CEO, and we are excited for you to join us for this educational video series that dives deeper into specific health topics that we know are important to you and the OAC community. Today's OAC Health Talk tackles another important topic, eating disorders, what to know and identifying signs, featuring licensed psychologist Dr. Connie Stapleton. Eating disorders can be a concern or question for many who are along the journey to improved weight and health. More specifically, it can be tough to know how to spot signs that you could be dealing with an eating disorder, in addition to having the proper tools in order to address this issue. Oftentimes, eating disorders can go undiagnosed due to stigma, a lack of information, or inability to recognize symptoms. Licensed psychologist Connie Stapleton will provide us with helpful information about the different types of eating disorders and the impact on your physical and mental health, while also offering hands-on tools to recognize and treat this important issue. And with that, take it away, Dr. Stapleton.
Hi and welcome. Thank you for joining me for tonight's talk about eating disorders. My name is Connie Stapleton. I'm a licensed psychologist, and I've been working in the field of bariatric medicine for at least 15 years, and time flies. So I wanted to thank the OAC for inviting me and help you understand what eating disorders are and how maybe to identify if you or someone you know or love has an eating disorder. And eating disorders affect a lot of people. You know, you think, oh, I've heard about that, but gosh, I don't really know anybody who's had one. But check this out. Eating disorders affect up to several million people at one time, up to 5% of the entire population, and that's a lot of people. Most often, eating disorders develop in adolescence and in young adulthood, but they can last through somebody's entire life, typically up to about 35, 40 years of age. But honestly, eating disorders affect so many people. And even though those are kind of the parameters, there are definitely people who are struggling with eating disorders, younger and older than that. And it is mostly females that suffer from eating disorders, but not only females. So don't discard the idea that maybe somebody in your family or somebody you love, or if you're a male yourself, you know, maybe you've questioned, do I have an eating disorder? So let's talk about what they are, what they're associated with, who's likely to have them, and how you might be able to tell, and maybe some treatment ideas as well. Here's something that's interesting, that eating disorders very often co-occur with other psychiatric disorders. Now, don't let that scare you, because even though, you know, psychiatric disorder sounds scary, a lot of us, myself included, have suffered from depression, from anxiety. I've had serious obsessive compulsive disorder that I've struggled with, and alcohol and drug addiction issues. So there's a big crossover between those kinds of disorders and eating disorders. So that can kind of tip somebody off. And sometimes these go together, sometimes they kind of track one after the other. But if you want a broader sense of, you know, maybe, gosh, I've struggled with these things, and now I've got this disordered eating, whatever disordered eating means. Let me tell you a little bit about how that's characterized. Disordered eating or eating disorders are they're behavioral conditions. It's when your behavior is out of the ordinary for typical eating. Typical eating meaning, you know, you eat to feel full, you eat for energy, you eat consistently throughout the day, but you're not obsessed with food. You're not thinking about it all the time. You don't inhale a lot of food at one time and then go through that guilt cycle. So eating disorders are behavior conditions, and there's a persistent and severe disturbance. So you may go for a week or two and you're like, oh, my eating's off, or whoa, that was a really stressful time and I didn't eat well during that time, or I ate more than I should during that time. But if we're talking about an eating disorder, it's more than just a little bit of time. It's pretty severe and it's pretty persistent. There's a lot of distress, emotional distress. Your thinking becomes confused. You're obsessed with food. It's out of the ordinary, not like, oh gosh, I'm hungry, let's eat. It's like, maybe thinking about food all the time. It feels almost like an obsession, and your emotions can be really intensified as well. So eating disorders can be very, very, very serious because they affect not just your physiology, but also your emotional state, your social interactions. And I will tell you, I suffered from a terrible, terrible eating disorder when I was 19, 20, 21 years old. I had severe anorexia. So I'm coming from a place of really understanding what eating disorders are and how to kind of work through them. So remember, if you are struggling with this, it's not something to be ashamed of, but it's absolutely something to get help for, because these kinds of eating disorders can really affect your long-term health. They can absolutely lead to death and to some long-term conditions, including heart, respiratory system, all kinds of things. And we'll talk about that as we go into some of the specific eating disorders. But when you seek treatment, or when someone seeks treatment for an eating disorder, you want to get treatment from a place that doesn't just treat. Obviously, you've got to get the eating stabilized, the eating behavior stabilized, but there's also psychological contributions to eating disorders. Like I said, there's often substance abuse, there's often co-occurring depression or anxiety. So you want a comprehensive program. And of course, behavior, nutrition, and medical complications. So it's a comprehensive kind of treatment because eating disorders affect all areas of your life. So let's start out with the typical ones that people think of: anorexia, bulimia, binge eating disorder, and night eating syndrome. So we'll kind of cover those four specifically, and if we have time, I'll mention some others. But these are primarily what we think of when we think about eating disorders. So anorexia, the title is anorexia nervosa, and it's really about self-starvation and significant weight loss that results in being below weight for your height and age. Now, we all know people who are biologically thin by nature and they try to gain weight. That's not anorexia. A person who is suffering from the disease of anorexia, and when I say suffering, I can attest to significant emotional, psychological, physical distress and suffering that goes along with this. It is an absolute willful act of self-starvation. Like, I am not going to eat. I refuse to eat. I'm going to eat as few calories as possible. I'm going to exercise. We'll talk about the compensatory behaviors, but anorexia primarily is categorized by the self-starvation, lack of caloric intake, and significant weight loss. And frighteningly, anorexia has the highest mortality rate of, check this out, of any other psychiatric diagnosis other than opioid use disorder. So anorexia is a significantly dangerous disease, and people do die from it. So if you know somebody who is obviously losing weight and you observe that they really stay away from food, or you see them counting calories, or they talk about calories a lot and they're really losing weight, this is something you don't want to ignore. And if you're a person who is engaging in this disease and people come to you, know that they're coming to you out of caring, even though it doesn't feel like it at the time, and you're going to insist that you're just fine. So the dieting that is the hallmark of anorexia, it's not just dieting, it's like almost starvation, like counting every calorie and knowing exactly what's in every single thing you eat, and sometimes just refusing to eat at all. What this is driven by is an intense fear of gaining weight. Now, that clearly has some psychological and emotional underpinnings. So this is why, in addition to helping people eat, you need to get them help, or you need to get help for these other issues as well, because it's not just about losing weight, clearly, but it is driven by this irrational, in most cases, intense fear of having any body fat, of gaining weight, or becoming what you consider large. And the other thing is, there's such a distortion in how you see yourself, because I would literally look at myself in the mirror, and speaking from my personal experience, I was 19, 20 years old, 5'4". Average weight for 5'4" should be somewhere between 120 and 40 probably. I weighed 87 pounds. 87 pounds. I was away at college, and there was a lot of things going on around me in my world that I didn't want to deal with. And so I focused in on this narrow existence of starving myself because I thought it was something I could control. So I was absolutely starving myself, barely eating, and I became very isolated, which could be another sign for people that you become very isolated. I didn't want people to notice that I wasn't eating. Some people will insist, I'm really trying to eat, I'm really trying to gain weight, but their behaviors don't match their words. So watch for that inconsistency between what they're saying and what they're doing, all right? Because there's often a very, very inconsistent pattern there. So they're going to eat only excessively low calorie foods, and they may exercise excessively. I know for myself, I ate oh my God, if I ate 500 calories a day, it was a lot. And I would walk miles to work while I was in college. There's two types of anorexia. One is the restricting type, where people lose weight primarily by dieting, by fasting, or excessive exercise. But there's also a binge eating purging type in which people also engage in intermittent binge eating and or purging. So some anorexics also engage in what looks like binging and purging behavior. But the hallmark is this really, really low weight. And some of the behavioral signs or some of the physical signs that you're going to see are people quit having a menstrual cycle. Women quit having a menstrual cycle. Sometimes there's a lot of dizziness or fainting because people are dehydrated. Their hair and their nails get very, very brittle. They're cold all the time. There's a big intolerance to being cold. They look very weak. Their muscles are wasting. You can see their muscles. A lot of heartburn and reflux, especially if they're vomiting. Terrible GI problems, bloating, constipation. There's even some bone loss and maybe some stress fractures if they're compulsively exercising. So there's a lot of depression, quite a bit of irritability, tremendous anxiety, very poor communication, and a lot of fatigue. The medical issues associated can really be life-threatening. As I said, there's a lot of fatality associated with severe anorexia. There's heart rhythm problems, a lot of abnormality there, especially if people are using a lot of laxatives or vomiting. There's kidney problems, there's seizures. So it's a very, very serious disease. And treatment, of course, involves normalizing the weight. You got to get the person healthy, and then treating the emotional, the psychiatric, the psychological issues that go along with the weight loss. Another common eating disorder that we hear a lot about is bulimia nervosa. So bulimia is typically, you'll see somebody dieting, eating really healthy or safe foods, and then binging. So you got this healthy dieting thing, and then you got this major binging kind of things on these forbidden, really high calorie foods. So the binging part is typically looks like eating a whole bunch of food, a whole bunch of unhealthy food in a short period of time, and people feel like they're out of control. They just feel like they're out of control to stop. They don't feel like they can stop. They're ingesting all of this food, and it's unhealthy food, and they don't pay that much attention to how much they're eating. It's oftentimes secretive, and people feel miserable afterwards. They feel shame, they feel guilt, they're embarrassed, they don't want people to know this. Binges can be large amounts of food that's consumed rapidly, and sometimes so much so that it brings about the nausea and a bunch of discomfort. And these binges, occur at least weekly. In order for it to be a binge eating disorder, because a lot of people have binged before, but it doesn't qualify as a disorder. So if it's a disorder, a binge eating disorder, it happens at least weekly. And for a lot of people I know, it's much more frequently than a weekly thing. And it's typically followed by what we call compensatory behaviors. Most people think of bulimia as vomiting, right? And vomiting is one of the compensatory behaviors. And that means I'm trying to get rid of, I'm compensating for all of this intake of unhealthy food by vomiting it out. I'm trying to compensate for that. But there are other forms of compensatory behaviors, such as going on long fasts, laxative misuse. I'm going to try to get it all out of me that way, or compulsive exercise. So binge eating disorder is the consumption of large amounts of food, feeling out of control, followed by a compensatory behavior. And the thing about bulimia is bulimic individuals can be slightly underweight, they can be a perfectly healthy weight, or they can be overweight. So, unlike anorexia, when you clearly give yourself away by the extreme weight loss, with bulimia, it's really hard to tell just by looking at somebody. So, if a bulimic person, the person who does the binge eating with a compensatory behavior, is underweight, they usually have anorexia nervosa binge eating / purging. It can get complicated. Sometimes you'll hear the word bulimorexia. So it gets complicated. Just know that eating behaviors that are outside the norm, that have an obsessive quality to them, that go on for a long time, fall into the categories of an eating disorder. There's a lot of disordered eating among people, but it doesn't necessarily constitute an eating disorder unless there's a lot of turmoil emotionally and this behavior goes on for quite a long time. So, some signs that somebody may be engaging in bulimia are frequent trips to the bathroom after a meal, right? Yeah, that's kind of a giveaway, but people can get away with this because they're not always around the same people. Large amounts of food disappearing out of the pantry or the cabinet, or unexplained empty wrappers and food containers, because this is often this is done in secret, right? Somebody constantly complaining about a sore throat or swelling in the salivary glands or in the cheeks. There's a lot of dental decay and tooth erosion because of the stomach acid when somebody's purging on a regular basis or vomiting. A lot of GI problems, a lot of reflux, a lot of acid reflux and heartburn. And there can be unexplained diarrhea because people's GI systems gets all whacked out and maybe they're using laxatives. People oftentimes also misuse diuretics, water pills, to try to lose that weight. And they may also experience fainting or dizzy spells because of the excessive purging that also results in dehydration. So bulimia can lead to potentially fatal complications. It's much more rare than with anorexia, but you can get esophageal tears from rapid ingestion of food and then vomiting the food. You can get a gastric rupture and a lot of heart arrhythmias too, because you disrupt your entire system. And there's the electrolytes with both disorders that are sometimes get out of whack, which affects heart rhythmia and stuff like that. So both of these are very serious issues and can be treated both on an outpatient basis or an inpatient basis. But I will tell you, when you're dealing with an eating disorder, a categorized eating disorder, you want somebody who's very trained in these kinds of things. Binge eating disorder is something that's pretty common too. And the binge in binge eating disorders, much like that goes along with bulimia, because people eat large quantities of food in a very short period of time. It's like people describe it as shoveling it in, not tasting it, not even being aware of what or how much they've eaten, because there's a sense of loss of control. Some people will describe it as almost a hysteria or a mental blank or tremendous anxiety, but it's an absolute feeling like I can't control this. And there's a lot of distress, a lot of emotional distress. But unlike bulimia, when people have binge eating disorder, they don't usually use the compensatory behaviors. So they're not vomiting, they're not exercising for hours on end, They're not using the laxatives or the diuretics. So it's just this ingestion of food that's really frenetic. But this too has serious health complications, right? Including diabetes, the development of obesity, hypertension, cardiovascular disease, a lot of really serious life-threatening health comorbidities. The diagnosis requires frequent binges. So if there's an occasional binge, which isn't necessarily healthy, but it may not constitute an eating disorder. So an eating disorder, binge eating disorder specifically, has to be at least, again, once a week for at least 3 months, associated with that telltale lack of control, and 3 or more of the following, right? Eating more rapidly than normal, eating until uncomfortably full, eating large amounts of food when not hungry, eating alone because you feel embarrassed by the quantity of food that you're eating, and feeling really disgusted with oneself, feeling really depressed, feeling ashamed, feeling really, really guilty afterwards. So that too is a really big problem. And you can see how this is physical. You can absolutely see that there are physical complications and repercussions associated with these eating disorders. But there's so much psychological and emotional damage because people don't understand, why can't I stop this? They feel like a failure. They feel helpless. They feel out of control. They're afraid to ask for help. They feel like they're a freak. They do a lot of name calling. They do a lot of self-shaming, and it's extraordinarily emotionally painful. So again, with the treatment for bulimia, the treatment for binge eating disorder includes learning to get the eating disordered behavior, the behavior of the eating normalized, but then also dealing with the shame, the sadness, the fear, the guilt, and what other psychological issues may be surrounding that. There may be depression going on, there may be anxiety, and for binge eating disorder, sometimes antidepressant medication has helped. And sometimes if there's a co-occurring like attention deficit disorder, it can help sometimes explain some of the impulse eating, but binge eating disorder is an issue in and of itself. But you always want to do a complete medical history, complete psychosocial, what's going on in your life, what's in your past, how are you feeling, do you have depression, anxiety, some of these other things. Now I'm just going to talk for just 1 minute about one other disordered eating behavior that a lot of people talk to me about in these last 15 years, which is night eating syndrome. And they're still doing a lot of investigating and research into night eating syndrome, but it is an eating disorder that occurs frequently with sleep interruptions. So people who have night eating syndrome feel like they won't be able to get back to sleep until they eat something. They absolutely feel like they have to eat something. They may wake up several times in one night, and they feel ashamed and they're depressed and they don't know why this is happening, but they feel like they have to eat before they go back to sleep. So there are some medications, there are some antidepressants, there's therapy that can work with this, but it also occurs quite often with insomnia, right? Because insomnia means you either can't get to sleep or you can't get back to sleep once you wake up. So this can happen quite a bit during the night, and it results in a lot of lack of sleep. And when you're not sleeping well, you're not thinking clearly, you're not being able to make the best decisions. So if you feel like you don't have control over that urge to eat in the middle of the night, talk to your doctor about this. Talk to your medical doctor, and you want to include in your therapy with all of these, definitely your medical doctor, and definitely a psychiatrist and or psychologist, and a therapist who can help you work specifically with these different eating disorders. Eating disorders are no joke, and people can go from one to the other, to the other, to the other, and they can, sometimes the eating disorder will be prominent. Maybe a substance abuse will take its place for a while. Then maybe there's tremendous anxiety. It's a big picture. treat your whole self because we cannot separate our minds from our bodies. And so get help for your mind, your body, your emotions, your spirit, your whole self. There's no need to stay stuck alone in this because you are not alone. These are very common. So find a support group, go to your doctor, look online for support groups in your area, and get help and get happier. Thank you so much. If you have questions, you can feel free to contact me through I've got a website, www.conniestapletonphd.com. Thanks for your time tonight. I appreciate you listening in, and it's your health. It's your responsibility this day and every day. So make it your best. Thanks so much.
Thank you, Dr. Stapleton, for providing us with such helpful information on the different types of eating disorders and hands-on tools to recognize and treat an eating disorder. The OEC has a variety of educational opportunities for you throughout the year, but one of the best places you can turn to for quality, unbiased education is our resource library. Simply visit obesityaction.org/library and check out our brochures, articles, guides, videos, and more health talks. Also be sure you subscribe to our YouTube channel to get notified of any future educational events and broadcasts. Thanks for joining us.